Okay, looks like we've got a good group of folks with us, so I will go ahead and get us started this afternoon. My name is Kristen Gangwer, and I am the Director of Operations at Produce Perks Midwest, and it's my job today to welcome you to the Produce Prescriptions Focus session of the 2021 Ohio Nutrition Incentive Network annual convening. So this afternoon, we will be hearing more about how produce prescription programs support health outcomes through increased produce purchasing power. And the presentation today will be about 30 minutes with 15 minutes at the end for questions. You can feel free to drop any questions in the chat as we go. ONIN members will be monitoring the chat, and we can answer questions there if possible, but we'll also save any really relevant questions for the live Q&A at the end and make sure to get those questions answered then. To begin each session today, we're going to be sharing the newly revised ONIN vision and mission. And so I'm going to read that off to you all now, just so you have it at the front of your minds. So we envision all Ohioans having equitable access to healthy, locally grown foods within their communities and the resources to procure them. Diet-related health diseases and disparities are no longer a public health crisis. Ohio agriculture is an economically viable and ecologically regenerative industry. It is an integral component of the Ohio food system. Its products are widely available. Ohio farmers and food workers are valued, respected, and appropriately compensated for their contribution to the health and well-being of their communities. Our mission is to increase nutrition security while strengthening Ohio's local food system. And if you're part of the keynote, you heard this there as well, but we're also beginning each session with a land acknowledgement, which we have sourced from the Ohio State University Office of Diversity Inclusion. A land acknowledgement recognizes and respects the relationship that exists between Indigenous peoples and their ancestral and contemporary territories. So we acknowledge that the state of Ohio occupies the ancestral and contemporary territory of the Shawnee, Potawatomi, Delaware, Miami, Peoria, Seneca, Wyandot, Ojibwe, and Cherokee peoples. These lands were ceded in the 1795 Treaty of Greenville and the forced removal of tribes through the Indian Removal Act of 1830. Finally, we would just like to ask folks to add their pronouns to their displayed Zoom name. You can just edit it yourself. And then if that's challenging though, you're welcome to share them in the chat box. And I am now going to turn it over to Debbie Serenius, our Director of Health Partnerships at Produce Perks Midwest, and she can take it away.
Thanks, Kristen. Well, it's lovely to be with everyone here this afternoon. I see a lot of familiar faces, but also quite a few folks that I don't know. So glad to be introduced to you today. And this is a very exciting topic, one that I'm very passionate about. So glad to have you join today to learn a little bit about it. So I'm going to share my screen. So today we're going to be talking about how produce prescriptions improve food insecurity and health by promoting produce. So I'm Debbie Serenius. I'm the Director of Health Partnerships at Produce Perks Midwest. And I tell you what, putting this presentation together, I realized all the P's in all of our names. So this is like a tongue twister to try to talk about Produce Perks Midwest and Produce Prescriptions PRX program. So I'll do my best. So when we look at just the basics of our PRX program, in case there are, some of you joining today that this is your first, your first time to hear about these programs. So we'll just kind of go through some of the basics. So PRX programs allow clinicians to provide monthly monetary fruit and vegetable prescriptions to patients that meet the criteria of food insecurity and diet-related diseases. So how the process works is these patients are recruited by a healthcare provider to participate in the PRX program. The patients then attend monthly visits with their provider to receive nutrition education and have health metrics collected. Pre and post surveys are completed. Patients are given monthly prescriptions for their family, And then the patients and family members redeem these prescriptions for fruits and vegetables at participating Produce Perks sites. We wanted to tip our hat to the Cleveland area prescription programs. I asked Amanda Osborne to share with me a little bit of information about the history of the prescription programs in Cleveland, because as far as I'm aware, they were the first ones in the state to start implementing these great programs. So they began in 2013, and as you can see, they have a list of great partners that helped produce these programs. The model that they used in Cleveland was a 4-month intervention in partnership with local FQHCs that connected patients to local farmers markets. During the intervention, the patients would receive $30 a month in fruit and vegetable prescriptions. They would give them cooking tools, nutrition education, and counseling around goal setting and fruit and vegetable consumption. They saw statistically significant results that have been shown for increases in fruit and vegetable consumption, decreases in fast food consumption, and increases in the awareness and utilization of the Produce Perks matching program. So they had a few different groups of patients that they worked with. They had pregnant moms, which started in 2013 and ran through 2018, where they served over 1,000 mothers. And then they also had a hypertensive group that started in 2014 and ran through 2018, where they served over 1,300 patients. In 2019, they partnered with the Cleveland Clinic and worked with patients that had a variety of diet-related diseases. Currently, their program has been paused due to COVID-19. So that's sort of the history of Cleveland, and they were sort of the, beginners of this work in the state. This is a little bit of the history of Produce Perks Midwest and our venture into prescription programs. So we began our programs, the first one started in 2018, where we partnered with the Cincinnati Health Department and 2 school-based health centers to serve a pediatric population. In 2019, we expanded to Dayton and Canton with adult programs, and then began a partnership with Mercy Health in the Cincinnati area to serve another pediatric school-based health center. In 2020, we launched infant vitality programs, which I'll speak a little bit more to in a moment, in Butler, Franklin, Mahoning, and Montgomery counties. We also expanded our partnership with the Mercy Health programs in Cincinnati and added 2 additional adult programs. The impact of our PRX programs in 2020 included 316 patients that we served, 1,250 household members, and a little bit above $66,000 of prescriptions were actually redeemed. These patients shopped and redeemed that much. In 2021, currently, we are expanding our infant vitality, and we have started another additional program in Montgomery County and also in Toledo. And we're also currently in the planning phase with CareSource and Lorain County Health Department to launch programs yet this year. So I mentioned the infant vitality programs, and we're currently operating about 8 of those. These infant vitality PRX programs are for pregnant, expecting moms and just postpartum moms. It's a state-funded intervention to improve birth outcomes and infant mortality in targeted counties. There are 9 Ohio Equity Institute counties that have been identified as having the greatest racial disparities in birth outcomes. And as you can see on this map, we have highlighted all of the shaded areas are OEI counties, and we are currently operating programs in 5 of them. Since we started in 2018, we've kind of developed a little portfolio of type of design models for these programs. It's important to us that each program is individual. We take into consideration, the clinic site and the patients that they're working with and how the program would work best in their community. So the traditional produce prescription voucher plan that we have provides $30 per household member per month in produce prescriptions, up to a max of $150 a month. And these vouchers are printed and mailed to the clinic, where the providers or clinicians distribute to their patients during their monthly provider check-ins. And how we came up with this amount is, we really wanted, if we're trying to measure health outcomes, it was important to us as a team that we provide the daily recommended servings of fruits and vegetables for that entire household, because otherwise we know a mom or a dad is going to be sharing that produce with the rest of the family, and you're not really going to be measuring the true impact as if they were getting enough fruits and vegetables. So a second model is we work with local farmers to provide a CSA vegetable box twice a month to the clinic site. The patients would come to the clinic to pick up the box, or the clinic staff would distribute the boxes to patients through various methods. And clinics got really creative about this. We had some using Uber Health. Community health workers would literally, bring the boxes to the patients when COVID hit. So again, the clinics got just really creative with their delivery method here. We have some programs that are the vegetable box, and we give a small amount of prescriptions. And that's sort of, they get the vegetables in the box, and then they can shop at participating sites to maybe round out their fruit and purchase that at farmers markets and retail stores. And then finally, we have a grocery delivery model that we started in 2020 in partnership with Mercy Health. The patients receive a box of both fruits and vegetables that are delivered right to their home twice a month. The produce is mostly sourced from a large farmers market in the Cincinnati area called Findlay Market. And then some items to fill out the box are then purchased at grocery stores. So that's sort of the high level overview of what our PRX programs consist of. But I thought it would be really fun to highlight a successful partner program. So I am going to introduce Veronica Caldwell, who I think I saw joined the call. And Veronica, I'm going to let you go over these next 3 slides.
Thank you, Debbie. Good afternoon to everyone. So in 2019, we were looking for ways to help with food insecurity in our community, establish nutritional awareness, enable and higher quality diet with the hopes to improve the health outcomes of our prenatal and postnatal mothers and babies. So in January of 2020, we partnership with Produce Perks Midwest. The patients would receive a box of vegetables bi-weekly. The local farmer would deliver them to the office, and the patients would come and pick them up on that same day. This is all pre-COVID. They will also receive a monthly prescription vouchers. This would enable them to purchase any types of fruits that they may have wanted to go along with the produce at the local farmer markets or a local grocery store that we were working with. The picture here is one of our community health workers would open the box and go over each of the produce that was inside the box to explain to our patients that would come in. Next slide. So in 2020, we had 2 sessions, both were 6 months each. During those months, the patient would have time set aside to meet with a dietitian and have their vitals taken by the nurse. Each patient would also complete a pre and post survey that measured what their fruit and vegetable intake is, their food insecurity, their stress, and what were their food preparation skills. And I think Debbie would show a little bit of that later. But looking at the difference in our birth outcomes from 2019 to 2020, Despite COVID, there was still a slight decrease in our low birth weight. I think COVID put a halt to a lot of what we were trying to do. As COVID continued to linger on and spread, the number of the participants decreased throughout both sessions. But I will say, I witnessed when the patients would come in on every Thursday, they would talk with each other about the different vegetables, that they had some that they had seen before, some that they didn't see before or never heard of or tasted. So they would kind of hang out in the office and share recipes and ideas. In this picture, I asked a couple of the patients, pull out something that you know and pull out something that you didn't know. So it looks like the rutabaga was the winner for unknown vegetables at that time. I will say that some of the patients did share that they missed that part of the Produce Perks program and coming in and talking with some of the other patients about the vegetables and recipes. Next slide. So we also created a cheat sheet. Once the patients would come in, the community health worker would go through each vegetable, but we know if they've never seen or heard of it before, they may forget when they go home. So we created a cheat sheet for the patients. So once they get home, they can look at the cheat sheet and figure out what vegetable was what. We would take a picture every morning of all the vegetables and put it together. And we also serve a lot of different communities. So we made one for our Spanish speaking patients as well as our English speaking patients. We also would do like different recipes because of the different cultures we serve. Our community health workers would look online up and try to find different recipes that would fit with the culture or the foods that they were used to, and connecting it with the different vegetables that they received.
Thanks, Veronica.
Yeah, that's it. Thanks, Debbie.
That's awesome. This was our farmer partner with the Dayton group, Mission of Mary Cooperative Farm, picture of the people that served that program, and they did a terrific job in doing so. Part of the program that we also incorporate is, and this, I think this picture was taken just before Five Rivers kind of shut down. We did our last live cooking class where we bring in a chef and actually teach the moms, how to prepare some of the vegetables that they're, getting in their box. And with this program, we partnered with a chef from La Soup in Cincinnati to do so. Retail partners for redemptions can be very important to the success of the program. And we had a wonderful independent grocer that we partnered with in Dayton. And part of our COVID pivot, which aren't we all sick of that word, pivoting, was to offer free delivery to our moms. And I'll show you some of the statistics. I think that really did help increase the redemption for these moms where transportation was a barrier. So just to give you an idea of some of the numbers, in the first group, we gave out a little over $20,000 in CSA vegetable boxes, and patients shopped and redeemed just about $800 worth of produce prescriptions. This was our larger group. In the second group, which was a smaller amount of patients, they redeemed about $10,500 in vegetable boxes. And like I mentioned, we added that retail delivery, and we saw patients shopping and redeeming more than double the amount using their prescriptions as the first group, about $1,800 worth. This shows you just a couple of the outcomes. We had each of the patients do pre and post surveys. So this first slide that we're looking at is from group 1. and there were 59 patients enrolled in this. When we surveyed them and asked them to rate the ability to prepare healthy food, we saw a 39% increase by the end of the program. When we asked about vegetable consumption, 66% of the participants ate 2 or more cups per day post-program, compared with only 32% pre-program. So we saw a pretty big jump there. When we looked at fruit consumption, 66% of participants ate 2 or more cups per day at the end of the program, compared to only 44% at the beginning of the program. This looks at our second group at Five Rivers, and there were 29 patients enrolled. This ran from July to December of 2020. Moms rating their ability to prepare healthy food as good or excellent increased from 56% to 76%. Moms eating 1 or more cups of vegetables per day grew from 56% to 82%. And moms eating 2 or more cups of fruit a day grew from 44% to 65%. And what's interesting to note is we did have some rollover in this group. We got permission from the Ohio Department of Health to allow moms to stay in the PRX program until their infant turned 1. So we kind of started at a higher level with some of these moms eating pretty good amounts of fruits and vegetables and learning how to prepare, feeling pretty confident about cooking a healthy meal, but we still got a big improvement. So that was really encouraging. So from my perspective, I get asked this question often, what makes a good produce prescription program? And my 100% top answer has got to be your partners. So if you're looking to start a prescription program, it's most important to have engaged clinicians. So picking that clinic site where they really have buy-in to this program, and that trickles down to the providers and the clinicians who will actually be interacting with patients. They are the key ingredient to a great prescription program. The second thing that you need are motivated patients. And again, this sort of, goes back to that provider or clinician. They're going to be able to identify that motivated patient. Now, if you have somebody who doesn't show up for appointments, who's terribly hard to get a hold of, in the office, it's not saying that you 100% don't include them in this program, but you run the risk of them not actually picking up their prescription vouchers, not actually redeeming them, not filling out their surveys. So they're a pretty key part of this. And then convenient redemption locations. So if you really need more than like one farmer's market that's open 4 hours a week, that's just not convenient for patients to be able to get to a site to redeem vouchers. So you really want at least 2 or 3 redemption locations. And I really believe a retailer is pretty key, so you have those shopping hours that are very convenient for the patient. And finally, the data collection, which has really been much more of a challenge during COVID because many of the in-person visits were stopped and more telehealth has occurred. So collecting health data has been a much bigger challenge, and getting folks to, fill out all of their surveys has been more of a challenge. But good data collection really helps, show that your program is effective. It helps get funding for the next round of programs. And it really just is such a key element and really important when you're trying to run a good program. So I'm going to show a little video. When Veronica and I were first talking about this presentation, there was a good chance that she was not going to be able to join us due to something going on. So we went ahead and recorded just a really short interview. So I'm going to go ahead and play that. Hi, and I'm here with Veronica Caldwell, who is the program manager of PRX at the Center for Women's Health at Five Rivers Health Center in Dayton. And she and I have become friends because we've worked together for a few years now with this prescription program. And I would just love for you all to hear her perspective on some things because she's truly a terrific program manager, and we've learned a lot from working with her. So thanks for joining us today, Veronica.
Thank you.
So from your perspective, can you just tell us some of the positive aspects of having PRX at your clinic?
Sure. The population that we deal with, there are a lot of food deserts in their area. So the one positive is finally being able to get them healthy foods, produce and vegetables, especially being pregnant or newly delivered. We need to have that nutrition aspect focused in on. So that was one positive. Another positive is the farmer would bring the produce to us here in our office. So we were able to get the patients to get to the office. If they needed transportation, we were able to provide that because they would come here to the office to pick up the produce that they need. And I think it was neat that they learned. We had a lot of ladies that learned new vegetables that they've never seen before, as well as try new recipes. And I think it also developed a community. When we first started, it was pre-COVID. So when the ladies would come in to pick up the boxes, they would kind of hang out and talk about what was in the boxes, what they didn't know, different recipes that they may have tried. Some of the ladies may have lived with their mom or with the grandma that knew what to do with a lot of the vegetables. So they were able to share their experience with it. So I would say those were a lot of the positives that we saw with this program.
Yeah, it's super cool about the community aspect. I think we're all kind of missing those days for sure.
Yeah.
Okay, well, those are all really great things, but I know with any program and managing people and these vouchers and everything, talk a little bit about some of the challenges that you encountered.
I would say just as a positive with a lot of the ladies learning new vegetables, learning new recipes, I would say the challenge would also be not knowing some of the vegetables. I mean, we are in Ohio, and when we started, it was in the winter months. So a lot of the ladies didn't know what to do with the radish, didn't know what to do with the rutabaga, or had never seen it before. And so to try to encourage them to step outside of what they were used to and try something different, I think that was one of the bigger challenges. I know some of the ladies, especially if they didn't have the support at home with a mom or a grandma, they kind of slid off the scale and kind of were not as engaged into the program when they didn't understand the vegetables that they were receiving.
Right. Yeah, that's a good point. Well, hopefully some of them will continue with a new vegetable. I think that's part of the beauty of the farmer delivering the boxes is, we hope to expose them to some new vegetables and hopefully a couple, some of those stick after the program's over.
And I would say that you have to be engaged. Our community health workers, they were really engaged, and we deal with a different range of different cultures we have. That's a part of our program. So our community health workers, they went online, they looked for different recipes that would favor something that the different cultures would be used to. We even had a community health worker, she made, I think it was butternut squash. So she made a soup for the ladies to taste when they came in, just to try it first and then try to make it themselves. So investing in the program and into the ladies, I think what made the program successful.
Yeah, I agree. The staff there at Five Rivers was amazing. is amazing.
Thank you.
What are some of the cultures you mentioned, just to give folks an idea of, you know, what kind of cultures are you serving within this program?
Sure. We have Russian, Turkish, Spanish, and Americans.
Yes. Okay. Yeah. So a good, an interesting group, very interesting group. So yeah. Awesome. Okay. And so I know this last session, we made the decision, or you guys requested going to a voucher program. So talk a little bit about that change, because I think you're in a unique position where you've seen both the CSA delivery, you know, option, and now you're using the prescription voucher. So talk a little bit about why you wanted to change, and, you know, anything you want to talk about.
Yeah, we talked about it with community health workers, and we did not like the fact that some of our patients would drop off from the program, because we felt like it was very useful for them to be a part of. So we decided if we just did all vouchers, they are able to pick the vegetables as well as fruit that they're used to, that they like, and still get that nutrition that they needed. So everybody could benefit from it. And I think it has helped in being able to work with the local farmer market as well as the local grocery store. They have, whether it's frozen, fresh, or canned, they have a huge option to choose from to kind of help them with that. So I think that was the main reason. We didn't want anyone not to be able to receive the produce and the healthy foods that they need.
Yep. Yeah, well, that's a good reason. Okay, well, anything else that you want to leave us with, or that you think people ought to know about this program?
I think it's a great program. You just have to invest in the people that you're serving, and it will be a success.
Well, great advice. Well, thanks so much, Veronica.
Thank you.
Okay, so let's see if I can get out of this. So I just want to put up both of our contact information. If anybody has any questions or anything, you can also put that in the chat. And I'm going to go ahead and stop sharing. And thanks for joining. I'm going to open it up for questions now. So I don't know, Kristen, if we had any.
The one that's been in the chat box was if you could give more details on what's involved in the monthly check-in with providers.
Yeah, that's a good question. So we definitely had to modify that a little bit during COVID, like I mentioned in the presentation, when you know, clinics went to more telehealth visits. But traditionally, once a month, either that community health worker or a dietitian or the physician will do a check-in with the patient where they're given their prescription vouchers. And during this check-in, we're asking the provider to fill out a short survey. We went to a platform this past year where they actually can do all the surveys and the check-ins on their phone or on an iPad or on their desktop. And they're just asked a couple quick questions. Basically, we ask if that patient is continuing in the program or if they're opting out. We ask them if any health metrics were collected at this visit, and those could be, you know, a blood pressure, a weight. In our diabetes program, if they got an A1C or a fasting glucose reading. We have collected lipid values in different programs. So, you know, if there weren't any of those labs done, they would hit no. And basically that was about it for the check-in. That provider touch point is really an important part of these programs, because we are assuming that that patient sees their provider, their physician, as having some authority and knowledge about their health. And so that provider giving them this prescription is saying, you know, just like I might prescribe medication or tell you other healthful ways to treat whatever disease that you're seeing that patient for, or the pregnant mom seeing her provider, that sort of carries some weight, that eating produce can be an intervention in your health and an important part of staying healthy. So hopefully that explained that.
And if other folks have questions, feel free to just unmute yourself, and or you can click the reactions button to raise your hand and we can call on you.
Great.
You know, I'd also open it up beyond question to partners, you know, Amanda Osborne, and I see a lot of ODH folks as well on here. If they want to speak to experiences, programs happening on a local level as well. So we can go beyond just a Q&A and open it up to dialogue.
And that's okay if there's no questions or dialogue.
This is Kat from Lorain County. Hi, everybody.
Hi, Kat.
So I have a question about the community health workers and how they're utilized in this example. So we have community health workers in Lorain County, but they so far are not very involved in kind of more of that upstream, like chronic disease prevention realm. It's been more so some other like maternal health issues, not so much healthy eating, active living. So I'm just curious of anyone on the call, you know, do you have community health workers who are working in this capacity? And can you explain the current structure for the example that you just went over? Like kind of what their, I guess, job description would be even.
I wonder, Veronica, are you still on the call?
Yes, I just hung up, sorry. So the question was about how we use our community health workers, is that correct?
Yes.
So Healthy Start is housed in a OBGYN office. So the patients come in, our community health workers will meet them while they're at their appointment and explain the Healthy Start program with them, the benefits of becoming a part of the program. And if they agree, they meet with them on a regular basis, we're not doing home visits right now. Right now we do emergency drop-offs if they need Pampers or diapers or wipes. But they talk on the phone, text, video, but they will always see them when they come into their appointment because they're pregnant. And closer to the end of their appointment, they will see them more and more. We also have a centering pregnancy program, so the community health workers will go and engage during the centering sessions as well. So they always have a close rapport with the patients, and they build their relationship with them to explain the produce perks and the benefits of them being a part of that program as well. So hopefully that answered your question.
And I think, Veronica, you bring up a good point that a lot of times a prescription program can be layered on another existing program, like you mentioned, the centering program or the healthy mom baby program. That's a really good place to look for layering on a prescription program because you already have those visits, you know, kind of set up. So it's not recreating, you know, another time that, you know, your clinicians need to meet with someone. So,
and the relationship has been established between the community health worker and the patient. So that helps
exactly.
a lot.
Yeah. It's a good question.
Thank you.
Okay.
So,
Yeah.
oh, sorry, this is Helen. I have endless questions, so I can just fill the chat box with questions if there is a need. The other, if folks are giving input on their experience, you know, we're looking at setting up a prescription program in a very rural area without any public transportation systems. So if anyone has experience either implementing or pricing out a delivery system that goes beyond emergency needs, but is just a core component of connecting folks with their prescriptions, with the food, I would love to hear their experience.
And Helen, I guess I'm not exactly sure what you're asking. So can you kind of repeat that?
Sorry, I was moving to a place with better Wi-Fi connection. I was losing it. Sorry. So we're setting up a produce prescription program that's in a rural place that doesn't have public transportation or a real centralized place for folks to get the food or get to the place with the food. So we're trying to figure out, you know, how can people actually pick up that prescription? We have for pharmaceutical prescriptions, we put them in the mail, right? But for a big box of food, that doesn't seem like necessarily the most effective option. So I just didn't know if there were places that had dealt with that and had set up a delivery system.
Gotcha. Well, I think, you know, in my experience working in different parts of the state, you kind of look at what community assets you already have. So potentially look at Meals on Wheels. If you're looking at a voucher program, you could mail the prescriptions to their house, but that's still, you know, you still have that transportation barrier for them to go somewhere to pick up, to shop or pick up the food. I know Care Source in Dayton was providing, you know, free transportation for grocery shopping. So you could look at some of those Medicaid providers if they have programs in your areas, as well as Dayton used Uber Health. That was an appropriate and allowable way to pick up the patient to go shop, or, you know, you could take them to go pick up the vegetable box. So those are just a few of the ideas that I've heard in different parts of the state.
If I may, before we get into the questions in the chat box as well, Helen, I'd also suggest if there's relationships with local producers that can coordinate production with the patient population, there's still the transportation piece, but from a delivery perspective with said, you know, producer, that too may be a way of connecting those dots, right? Is the building that relationship with that producer to grow food specifically for the patient cohorts.
Yeah, that's a good point, Tevis. And we do have some of those programs where the farmer actually will deliver to the clinic. And we just build in a little delivery cost for that farmer as well. That's just, you know, included in the cost.
Debbie, one of the questions in the chat was, are there PRX programs connected to WIC offices in the state?
That is a great question, and not currently, but we are talking with WIC out of Columbus as to how to, you know, integrate PRX programs, you know, partnering with WIC. Some great ideas are coming out of those conversations. So I would say that's to be determined.
No, and Amanda Osborne, if I may call on you, I do believe Cuyahoga County was doing some pretty great stuff with the WIC office at a county level there. So not to put you on the spot, Amanda, and apologies if I'm mistaken, but perhaps you could speak a little bit to what's happening out of Cleveland.
Not particularly for prescription right now, but there is a WIC-based incentive that will be shared during the next session that's focused on agency partnerships. So there is an additional WIC incentive provided to WIC FMNP recipients. So that'll be shared in the next one. So not a prescription per se, but another incentive.
Mm-hmm.
Great. And then there was another question about regarding kind of delivery from producers, are there any grants farms can apply for to cover these costs for customers?
So that's a little tricky because I think you would have to be partnering with, the funding would come from whoever is funding the prescription program. And so the cost of the delivery and, sourcing those vegetables from the farm would be included in that funding. So the way for a farmer to get involved in the program, it would have to be through, a prescription program and their funding partners.
I would add to that, Debbie and Andrew, I mean, so nutrition incentive programming and PRX prescription programming is recognized at a federal level as an evidence-based model that is supported federally through both the Gus Schumacher Nutrition Incentive Program as well as other grant-based opportunities. I know there's a lot of subject matter experts on this call right now, so please jump in and chime in accordingly. But I would anticipate the short answer, Andrew, is yes, there is. But to Debbie's point, it really is determined on who that funding entity is. But I think the short answer is yes. And if I may as well add a bit to the WIC question, and I want to see, yeah, Andrew, you had asked about the PRX WIC connection. And I'm sorry, Tia, you had asked about the grants being covered for the farmers. And Andrew had asked about the WIC. Yeah, as we continue to build out the PRX program at a state level, as it relates to infant vitality, at least, there's strong collaboration, partnership around the design and how the work of the programming further integrates into the WIC department and leverages services and so forth. So yes, there's a close working partnership and the dialogue around how to further design the program so it leverages WIC offices and just deepens the impact is an ongoing conversation and dialogue, and we look forward to what's to come with all of that. It's a good question, Andrew.
Yeah, kind of a logical partnership, especially with the infant vitality, targeting those pregnant moms.
It looks like Helen had a kind of clarifying question from an answer before. She said it's Medicaid, non-emergency Medicaid transportation funds that are able to support transportation to food, not just to medical appointments, or a different benefit?
So, and I don't know if this is completely the same in every part of the state. That's why I mentioned that you may want to reach out to your, regional Medicaid partner, but CareSource was offering, and it was a different benefit just to take folks shopping, especially I think it was one of the changes that they implemented during COVID. They were finding a lot of their participants were not able to get to the grocery store or do so safely. So they were offering that benefit that you could go shop, at your grocery store to pick up your, your food, or a farmer's market as such. I don't know how many times a month that benefit was available, but that was in the Dayton area that we were made aware of that. And then, like I said, another clinic used Uber Health for that. So I'm not sure. So I would just maybe, look at who the predominant Medicaid provider is in your area and reach out to them to see if that benefit is available in your area.
A question just came in from Kayla. She's not sure if it was mentioned or not, but could we see this programming being implemented into school systems and working with school nurses, et cetera? She said, I know this isn't directly connected to infant vitality.
Right. But yes, and that was how we first started in this space, is we worked with two. So we've had programs in 3 different school-based health centers in Cincinnati. And I know in Cincinnati, it's a little different. you know, in the urban schools, they will have a clinic that's actually oftentimes in the school building or very close to that, you know, that serves the students and their families, which is really kind of a nice setup. So we have implemented programs there, and we think that that's a great population to target, because when you're working with, you know, the kids, often they can be big influencers in how the whole family eats and eating more fruits and vegetables. So great question. We have done that, and in our planning, we are looking to do more of those because we really believe in them.
Okay, well, it seems like maybe the questions have paused, and I think we're a couple minutes technically over. So thank you all for joining us. I'm going to put in the chat box the registration info for the next 2 sessions in case you have not registered. It's not too late if you're interested in attending either of those. If you have already registered, you would use the link that you would have received in your email. But if you haven't, you can use what I put in the chat box. And I also put my email, because if you have any questions or problems accessing the Zoom, just feel free to email me. And if it's your last session of the day, thank you so much for joining us. We will be following up next week with session recordings, notes, and contact information. And we hope you've been inspired and intrigued by what you've heard today. So thank you very much. And I will put that in the chat right now.
Yeah, thanks everyone for joining.